Okay, so remember the days we used to sleep in our makeup, not wear sunscreen? Well, it's all adding up. The FDA recently gave the thumbs up for what's called a liquid facelift. We're going to do it right in front of you. So we have Dr. Sherry Ingraham with Advanced Dermatology here to show us how it works with our beautiful model slash patient, Cindy. So kind of walk us through. I've never even heard of this. What is it?
Yeah, so this is Sculptra, and Sculptra's actually been around for many, many years. It's FDA approved for filling of the face, but it recently got approval as a collagen biostimulator because for the cheeks, it stimulates collagen to make our skin glow, and there's now 2-year data showing not only were we able to fill in hollows for many years, but now we can actually stimulate surface collagen with it. The studies show that patients have firmer skin, tighter skin, and a glow after 2 years. So now we're FDA approved for the cheeks as well, which is really exciting.
Wow. Okay, so collagen is something I know everyone's always touting it. Collagen's great. We all want it. So are you actually injecting collagen?
No, that's what's really interesting about this versus like hyaluronic acid, the typical fillers you see in the lips and the cheeks. This is a collagen biostimulator. So I'm injecting poly-L-lactic acid, which are tiny little microparticles that go in and then they stimulate your body's own collagen.
Okay.
So what's exciting is by doing that, you're going to slowly grow tissue over time. And what's really, really exciting is that it's your own tissue, so it lasts longer. So you get about a 2-year improvement we see, and typically patients will come in once every month. For about 3 months, I will do a treatment once a month for about every 3 months, and about 3 months after each treatment is when you'll see the maximum impact. So not only will you see the cheeks lift, you'll see the jawline really firm up and lift, but you'll also see that overlying skin glow. And that's what's so exciting about this new approval is that the data is in showing that not only are we stimulating collagen deep within the skin, the dermis, but we're stimulating the superficial layers to really tighten it.
So after not this treatment, but after 2 more, Miss Cindy's going to be seeing the effects for 2 years? She's going to be looking fabulous?
2 years minimum. And she'll start seeing the effects from this first treatment. Some patients, depending on age, skin status, will start seeing them right away. They'll say, you know what, I haven't seen those deep furrows grow in yet, but I see that glow already. But what I'll do in patients is I will fill their temples, I'll fill their cheeks, and then we'll do a little liquid facelift where we're lifting back here in the preauricular area in front of the ear, and this really pulls the skin back beautifully.
So how much does something like this cost?
That's a really good question. So typically you're looking at about $850 to maybe $900 per vial, but I could theoretically do a whole treatment with 1 to 2 vials.
Okay, so that would be for 3 treatments, 3 months, it would be $800 each time?
Each time, or if you're doing 2 vials each time, you multiply that times 2. It just depends on the patient. But today we're just going to do 1 vial, and we're going to get her cheeks completely full with 1 vial.
And so a facelift where you would actually go under the knife, like that would be obviously more invasive, but more expensive too?
You're looking in the $15,000 to $20,000 range. Now, of course, you're going to get more dramatic results like that, but you're also going to undergo general anesthesia.
So, Miss Cindy, this will make you happy because our producer just said she can tell the difference already.
Yes.
In the sides of your face that doctor's working on versus the side that she hasn't hit quite yet. So the difference between this and Botox and fillers is that it's encouraging like your natural
your body's
response.
own collagen to slowly grow in. And while you were mentioning, you know, getting a facelift, a lot of my patients have had facelifts, right? You can only have so many facelifts. So a lot of my patients have had facelifts, but they are still having that normal facial atrophy that occurs with age where we lose our subcutaneous collagen and fat. So they'll come in and we'll touch it up with Sculptra.
Miss Cindy, can you look into this camera here, the one with the red light, just so we can see a comparison here of the side that we worked on versus the side we did not, so people can see. And Dr. Ingraham, for people who want to learn more and maybe want a consultation, where should they go?
They should go to advanceddermatologymd.com. They can go to our website, or they can go to Galderma's website, or even Google Sculptra. And you want a board-certified plastic surgeon or dermatologist like myself to inject this treatment. And you can even come in for a consultation at our office.
Just ask your questions.
Absolutely, absolutely.
Thank you. Happen right in front of our faces. All right, 36 minutes after the hour.